The April 23rd meeting of the Human Services Committee will now come to order. Will the clerk please call the roll? Legislators, are you ready?
Mr. Ansello. Miss Andrews. Dr. Carbone. Mr. Daniele is excused. Chairwoman Draw.
Here.
Miss Cayley. Mr. Lightfoot is excused. Dr. Quattro. Mrs. Valerio.
Is there anyone signed up for public forum?
There is not.
And I see no one else who would like to address the committee. So the next item on this agenda would be the approval of minutes. You have before you the March 26, 2013 minutes. They will stand approved unless the clerk is notified of any changes by the end of the day. Next item on the agenda is new business. Madam Clerk.
Referral 13-119, acceptance of a
Moved by
grant.
Legislator Quattro, second by Legislator Valerio. Is there any questions on this? Legislator Ansello?
Yes, about how many children are expected to be vaccinated each year?
Through you. Through the chair.
Through you, Madam Chair, the projection is to enroll 5 schools in the first year and 65 schools in the second year. The hope would be to immunize somewhere between 20 and 50 children per school.
Thank you.
Thank you.
Is there any other discussion on this? Legislator Andrews?
Madam Chair, through you, can you indicate which schools participated in the recent collaborative?
Through you, Madam Chair, I don't have that information with me right now, but I believe I can dig it up.
Thank you, that'd be great. And then following up on that, through the chair, what were the vaccination rates for the participating schools compared to the non-participating schools?
Through you, Madam Chair, it's kind of a complicated question. In either of the schools, some of the children received immunizations in the school and some of them received immunizations through a primary care provider. And so when you try to figure out what the immunization rate was for the school, you can't just count the number of shots that were given as part of the intervention. But the evaluator that looked at the statewide immunization registry and was able to determine that the schools that had the intervention had higher rates of immunization.
All right, thank you. Did you say there's 5 schools for the first year, and then did you say 15 or 65 for the second year? I don't know why I forgot.
65. I'm sorry, through you, Madam Chair. 65 for the second year.
And thank you. So the first year, which are the 5 schools that you will be doing this in? Through the chair.
Through the chair.
I'm sorry, I don't know that information right now.
If I could get that, that would be great. And then how many through the chair? Is this just a 2-year program, or is there a 3rd year through the chair?
I believe this is just a 2-year program, through you, Madam Chair.
Thank you. And then through the chair, is the total cost of administering this program just the $9,900 that we're accepting with this grant?
Through you, Madam Chair, no. This is a project that is going to be done by the University of Rochester, and our Deputy Director, Dr. Byron Kennedy, is going to be participating as a consultant, and so the $9,998 is just to purchase some of his time.
Got it. Thank you. And then through the chair, when you provide the information about the schools that have been selected, or maybe you can answer it now, were those schools selected because they have lower than average vaccination rates now, or was it random selection or targeted towards a certain part of the county? Through the chair.
Through you, Madam Chair, the strategy for selecting the schools is to try to find schools that are similar, so that they can look at whether the various interventions that they will be employing to try to enhance the vaccination rates, whether they work better at some schools than in others. So the idea is to get schools that are in many ways similar.
Okay, thank you very much.
Any other discussion? Seeing none, all those in favor signify by saying aye. Any opposed? Item carries. Next item.
Referral 13-120, acceptance.
Moved by Legislator Carbone and second by Legislator Ansello. Is there any discussion on this? Legislator Cayley.
Through the chair to the administration. A couple questions on this. Firstly, if I understand the way that I'm reading it, that the target population in trying to increase the health benefits of immunization are the senior living situations in the poor neighborhoods or poor activity, poor areas. Is that correct when you're talking about disparities?
Through you, Madam Chair, the population that live in these high-rise apartments are low-income individuals. Mm-hmm. So in that sense, they have low-income levels.
Thank you. But in terms of health assessments, we're equating a low-income situation with perhaps a lesser health level as well, good health level.
Through you, Madam Chair, yes, that correlation exists.
All right, thank you. And then finally, through you to the chair, I don't know if I'm leaping to a conclusion, but HPV to me means human papillomavirus. Is that what we're talking about here, or is that just part of the grant that's applicable here? Through the chair.
HPV is just the name of the grant. Doesn't refer to human papillomavirus. I'm sorry, through you, Madam Chair.
Okay, thanks.
Any other discussion? Legislator Andrews?
Thank you. Could you identify which high-rise or low-income senior housing units will be part of this?
Through the chair.
Through you, Madam Chair. I have it here in front of me somewhere, but I haven't been able to find it. But I will provide it at the end of the meeting, or we'll get it to you before the next session.
Thank you. And then through the chair, could you just give a brief description of what you actually plan to do as part of this program?
Yes, through you, Madam Chair. For each of the sites, there will be an educational session that will be advertised at the high-rise and will educate the residents about the value of pneumococcal immunization and zoster immunization. And then at a later time, the clinic will be scheduled and will hopefully be able to determine how effective this sort of approach would be in trying to increase immunization rates in a relatively high-risk population.
Thank you. And then lastly, is this a multi-year grant or just a one-year grant through the chair?
Through you, Madam Chair, this is a one-year grant.
Thank you very much.
Any other discussion? Seeing none, all those in favor signify by saying aye. Any opposed? Next item. Item carries. Sorry, next item.
Referral 13-121, acceptance of a grant.
Moved by Legislator Ansello now and seconded by Legislator Valerio. Is there any discussion on this? Legislator Cayley.
Madam Chair, through you to the administration. This may have come across before, but I don't recall it. And I was just curious as to how the Medicare Patrol interacts with the target population.
Through you, Madam Chair, in order to provide outreach and assistance to seniors, the locations for the SMP volunteers are placed within the community, include but are not limited to the following faith-based organizations: healthcare centers, hospitals, senior retirement communities, senior centers, beauty salons, barber shops, and other locales where older adults congregate.
Thank you. And through you, Madam Chair, can you estimate how many patrol members you have at any given time?
Target number for this grant is 15.
Thank you.
Through the chair.
Thank you, that's it.
Thank you. Any other discussion? All those in favor signify by saying aye. Any opposed? Item carries. Next item.
Referral 13-122, acceptance of a
Moved by
grant.
Legislator Quattro and seconded by Legislator Valerio. Is there any discussion on this? Legislator Andrews.
Thank you. And through you, this is a pilot program, and it's the first year we've received this grant. So could I just ask for an explanation of what the pilot program is intended to do?
Sure. Through you, Madam Chair, it's important to know that in New York State last year, there was 250,000 reports of elder abuse, and of that 250,000, there was 4,156 identified cases of financial exploitation statewide. Of that, last year, Lifespan had 44% of their elder abuse cases that were financial exploitation. So this grant's going to try to get interventions for those folks and some help through the use of forensic accountants and other law enforcement personnel.
Thank you. And through the chair, then, if I read the grant correctly, Lifespan was chosen by New York State, not the county, to administer it.
That is correct.
Okay.
Through the chair.
Thank you very much.
Any other discussion? Seeing none, all those in favor signify by saying aye. Any opposed? Item carries. Is there any unfinished business to come before this committee tonight? Seeing none, there's no further business. The April 23rd, 2013 meeting of the Human Services Committee will stand adjourned, and the next meeting will be Tuesday, May 21st at 6 p.m. Thank you. Have a nice evening.